Hi, welcome to the Hot Flashing Podcast. I'm your host, Anne-Marie McQueen. This week, I'm going to Florida in the United States to speak to Dr. May Hindmarsh. Dr. May is a retired physician of 30 plus years. She's almost 60, and she's a truth seeker. She's a truth seeker in life, in midlife health, and she co-hosts the BS Free MD podcast with her husband. I love that, BS Free MD. There she blends real world medicine with lived experience and talks about everything from hormones to long COVID and what actually works and what doesn't. She's right up my alley, doesn't pick a side, and we really get into it. This is quite a long conversation, but I think it's worth it. We touched on COVID, but she's going to come back because I think a lot of us are struggling with this. As always, this is inquiry. This podcast is not medical advice. It's for informational purposes only, and you should definitely not make medical decisions without consulting your provider and using your own common sense. I hope you enjoy my interview with Dr. May Hindmarsh. I'm Anne-Marie McQueen, journalist and proud 50-ish woman, and we are here looking for the true truth in perimenopause, menopause, midlife, and beyond.
Opening our minds to other possibilities is not always easy.
Hot flashing.
You're all woman to me. All right, Anne-Marie.
We have circled each other because you're a sort of a rare doctor, in my opinion, who has their eyes open to a lot of things that are going on, and that this interview might be a bit shocking for some people if they tune in and they don't know some of these things or believe some of these things. We're going to try not to go too crazy, but I'm a journalist, you're a doctor, who are sitting here going like, there's all these reality tunnels, there's all this stuff happening, it's actually happening, and we just want to be no BS about it. We don't want to have to pick sides. We just want to say what's happening and what we see. And that's Absolutely. So BS Free MD, let's start with that.
So it's funny. I think that my husband and I are both family practice trained doctors, trained in Canada. I actually went to medical school in Canada, in Saskatoon. I think it was one of the best medical schools, and did our residency in Edmonton, Alberta, and did a lot of rural family medicine training and really deep nitty gritty. We were trained as scientists, and I think things have changed a lot. Not to really pick on the medical school training now, but I really see, because we did a lot of work with the students, residents, and not just medical school training, but PAs and NPs. And things have changed, and I feel already I'm dating myself by saying back in the day it was so different, and at least we were very blessed with our training to think of as scientists. And so we always looked at things, even though we were being told something by someone like the pharmaceutical reps when they would come through, to kind of question things a little bit. And also our experience really does count, meaning what we see in clinical medicine really match what they're telling us? And so, of course, our sample size of our own patients is small compared to maybe a big study. However, real clinical experience matters. And when you talk to other clinicians, we would look back on things and say, well, they're saying X, Y, Z, but this isn't matching, with what I'm seeing. This is back in the 90s. And I was telling you earlier that, my husband and I started to question, and not to start to go on the vaccine rabbit hole, but even giving hepatitis to newborns. I'm like, why are we giving a hepatitis vaccine to newborns when, if their mothers aren't IV drug abusing prostitutes, their risk is like pretty much nil, and you could wait till later on, and we're already starting to put a lot of stuff in their immune systems. This makes no sense, and just overwhelming their immune system when they're young. And as time went on, and then of course through things we were seeing, I'm going to say even my experience with some of the statins, I was like, this is, I'm not believing the data versus what I'm seeing. And then fast forward to COVID, when I think the whole world had the Band-Aid ripped off, and we learned that a lot of the data and studies was a lot of misinformation, and what we were really trusting the government to give us information on studies that we thought were reputable or not. And so I would say right prior to the pandemic, my husband and I, because we talk about work a lot at home, much to the chagrin of our kids at home, and there's a lot of table talk, but we would question things, talk about stuff, and not always agree, which made for fun conversations. But we basically, my husband would always say, we got to call BS on some of this stuff that doctors are believing, because going to medical school, he likens it to being in the priesthood. I mean, you're taught these things, you're inundated with information, and you're taught that this is how it is because, the big corporate, big pharma, the government says, and then you sort of regurgitate it. And now the day of algorithmic medicine. And we really wanted to question that. And our podcast started during COVID, helping people sort of discern what is true, what is not. Do we really need to panic? And then we started just covering everything from COVID to all kinds of topics. I mean, one year we literally talked about diet and exercise, like what is the right diet, from carnivore to vegan to you name it. And we like to look at both sides and take more of a scientific point of view and question things. And that's what science is. And that's what I love and so excited to find you and love what you're doing as a journalist, because I mean, physicians need to have more of that journalistic mindset of like looking at both sides instead of believing what they're being told by whatever organization. It's hard to keep up and read all the studies and the information. And there's only so much time to do that. But that's a lost art as well, is that people in med schools, whatever schools, are not learning how to actually have a critical eye and actually read data and read studies. And so when people throw out things like, well, the risk, dropped by 1%, but, sample size is small, they don't even understand relative risk versus absolute risk. And that's appalling as well. My son in engineering probably can read studies better than a lot of doctors. So there's that. So the whole BS-free MD thing really was born out of our experiences, our training, but what we were seeing over the years, not jiving with, what we're being told by whatever organization or governing body to pharma. And then with COVID, everyone's eyes, it was like two different lanes at that point. But I think that was the big thing.
Yeah, but it's become like reality tunnels. Like people are living in tunnels where they literally can't see or bear to hear anything that's outside of, I guess, what they're reading. Or so COVID is a good example of that. And we'll just talk a little bit about it. So you were working on the front lines. You were treating people with COVID in Alberta during the pandemic. Okay.
No. So not in Alberta. So actually we had moved down to the US in 1994 to Oregon from Canada. And that's a story and a half in how we got to the US because of some restrictions in the Canadian government and healthcare then. And the US had opened its arms because they needed more primary care. I
remember that when the doctors were going to the States. I remember that was because my mom was a nurse, and it was, you had a lot of opportunity there.
There was this 2-year window when they restricted where new graduates or even people wanting to change provinces could work, because in Canada, to work, you have a billing number to the government. They're the insurer, the payer. And they wouldn't hand out a billing number to you if you didn't stay in the province where you did your training, either medical school or residency. So that meant you were stuck, stuck is a word, but you could not go anywhere else to work. And the US at the time was trying to have more primary care involvement instead of people hopping from specialist to control things. So the doors opened and there was a mass exodus. So yeah, my husband and I came to the US in 94, small town rural medicine in Oregon. I called it the American mission field. It was rough and tumble, and we did the whole gamut from hospital medicine, ICU. He did a full OB practice. We were coroners, call alternating all the time. It was nuts. And then I transitioned and switched over to urgent care in 2010 for various reasons, and he followed suit in 2013. And so we were working for an organization actually in Eugene when the pandemic hit. And at the time when it all, funny enough, when it hit the news, we were on vacation in Arizona, watching it all go down in China. And we were 2/3 of the way through the Great Influenza book, because we would listen to it on Audible as we drove to work on our commute. And we were listening to that book, and we were 2/3 of the way through. And then we were visiting our my sister-in-law in Arizona when it all hit the news. And we went, oh, crap, this is the 100-year pandemic. It's coming back. This is it. And so when we got back home, we were supposed to actually have a vacation at the beginning of April for a couple of weeks to Hawaii. Well, we didn't get to go anywhere because the whole world shut down, and we got furloughed at home. And literally we were glued to the television, the news, watching everything that was coming out of the mouths of, from Fauci to Trump and everybody in power, and trying to make sense of what was happening. And then we were inundated when we had time to respond to friends, to patients, people. And we started doing Facebook live streams once a week to answer questions from our home library. And then, yes, we worked through COVID. Where we were working, the urgent care became the basically COVID center because everybody funneled it all their patients through to the urgent care side. So we went out to the cars and tested people doing all the swabs and the full hazmat gear, and then saw them in clinic, donning and doffing all this gear and wasting money and all the, yeah, it was nuts. And so telehealth, the whole bit. We did that through the whole pandemic and actually switched jobs and went and helped a former resident that trained under us opened a clinic in a small town where we were living, and we saw COVID exclusively. We had people coming from, all over the US, the Western US, because we were actually not afraid to see people that were sick and use some alternative therapies that were hard to get a hold of. Oregon government had given us actually monoclonal antibodies. Nobody else wanted to use them. And we're like, we'll try this. We'll try some ivermectin if we can get it. We'll try whatever. We did nutraceuticals and infusions and NAC and NAD and whatever we could do to help people stay out of the hospital at all costs. And so my husband he says, a PhD in immunology training from doing so much research and reading on it. And we just kept our eyes open and got connected with doctors throughout the US and even through some of the groups we were on through some international docs, and just kept open to what was happening throughout the world and what we were seeing in our experiences and what they were saying. And then, I would say the light bulb, started going off when they said there's so many things that happened. I'll just stop there because we could talk about it forever, but there were so many things we were seeing, and we started questioning, and we just started questioning all kinds of things on our podcast. So
yeah. So you can listen to our podcast and listen to them question many things. I question many things too. So that's why we're talking.
Polarization, really came to a forefront in my brain, with COVID, because, and everyone can attest to the fact that doesn't matter what side you still believe or believed, there was people, it was worse than politics. People being not just losing their jobs, but losing friends and family over it, from funerals to weddings to you name it. And then I just see the same thing happening. And I'm excited to get into this because it's all about hormones. But what's happening in the hormone world really reminds me of that. It reminds me of a few other things in medicine, but here we are, to hormone or not the hormone, HRT versus natural. It's very polarizing as well. And, now with new data coming out and everyone's picking a side.
Yeah. And picking cherries as well. Okay, so we're going to talk about this. Picking the studies that support what they believe. This is something I see all the time. Okay, so you were working for a long time before the Women's Health Initiative, and you were working with women going through menopause. So just tell me what your experience was and what you saw in your practice and the use of hormones back then, before you went through menopause.
Exactly. So when I was young and fresh out of school and open to things, I actually did I called myself the psycho-gynecologist in our group, because I, as a woman, saw a lot of female patients. I'd say probably 90% of my practice was women, a few men, and kids, but I didn't do OB, so that limited the kids too. But I did a lot of counseling, and I've always loved that. And gynecology, that's what showed up on my doorstep, right? So I got to be the pretty good. And there was, back in the day, there was myself and later one other female doctor, other than if you went to the gynecologist. So I got referred a lot of patients from my male colleagues to help manage, whether it's oral contraceptive use, menopausal type things that women were going through. And so I just became interested in that. I used a lot of natural therapies back then, and I've always been open to non-pharmaceuticals. So using black cohosh and evening primrose and vitamin E, and those were the things we had available back then to help women through menopause, as well as, the importance of sleep. And I've always been an athlete, so the importance of taking care of your body with food and the nourishment that goes in. We had little in the way of options for HRT. We had Prempro, which was the combined Premarin and Provera, and then Estratest was available, so it had the estrogen and the testosterone together. It was pretty much set as far as the doses, and it was one of those things where it was like let's try it and see how you like it. And then I would have some women that just loved it, responded really well, and others would say, I feel horrible on it, makes me feel worse. I'm irritable, it makes me more crazy, I don't like it, and no, I don't want to try that. So we would look at something else, but it was really pretty limited what there was as far as options. Birth control pills, really, I was very cautious on the use of those in women past the age of 35, I should say 40, 45, because of, the risk for clotting to go up, especially if they were smokers. I would really discourage that because I did see clots. But as far as using like the Premarin and the Prempro, it was pretty limited. As far as
Those are the synthetic forms too, right? Sorry to interrupt you.
synthetic.
Yeah.
So as far as anything else, like compounded hormones were just not a real big thing in where I was in my space, and I don't think in general. Now, I actually personally did start seeing a naturopath myself, and I remember them talking a little bit about it. I wasn't on them myself then, but it was just kind of coming into play back later in my career. So it was not something I ever really got that educated on any of the compounded, but there was a few things just coming out. Testosterone was the big one I remember early on. I'm going to also backtrack and say estrogen cream, though, had been around for a while. And I remember, everyone now talks about, there's this big secret that you can take estrogen cream and put it in the periurethral area. And it really helps with genital urinary symptoms, menopause, by the way. That, I don't know, is a long-term trick that I don't know even where I learned it, probably in medical school from one of the gynecologists or urologists I trained with. But I remember using topical estrogen cream throughout my whole practice. A lot of times people, would send their patients to me like, I can't figure out why this lady has recurrent UTIs. We've got her on everything. We're doing all the things. This poor lady needs some topical estrogen, will help her urethral tissue, and I would explain how that worked. So I guess I was just blessed to have learned that back in the day, because I look at everyone talking about it like it's some new thing that they've just figured out, and it's not. But if you didn't have that experience, how would you do? So that was the other thing in my toolkit, was the topical estrogen for localized symptoms, and women that had a lot of severe vaginal dryness we would use. And I never had any worries about it being absorbed systemically. We just didn't see it on labs. Testosterone was not a thing. I remember in men, it was just starting to come into play, and they were using it incorrectly. Just having them come into the office and giving a guy a big whack of testosterone once a month. And then I remember some of my colleagues, they go like, most of these guys hate it. They feel like great for like the first couple of days to a week, and then they come back and they feel worse, and they're getting man boobs. And I remember thinking, we talk about doing blood levels, and like, yeah, they go sky high and then they tank. And, that was early on that we were starting to like look at levels and try to pay attention. And, when I got into urgent care, I really wasn't dealing a whole lot with it and wasn't really keeping up in this space. And that was in the, 2010 era, like I said.
Can I just stop you and ask about the Women's Health Initiative and that? Were you practicing then, and what did you think?
I was. Yes. I remember that came out. Wasn't that 2008? I'm trying to remember.
2002. 2002.
Okay. Yes, 2002. And then I remember throughout that, sorry, I don't know, I thought 8. I remember that hitting like a ton of bricks, because all of a sudden people are coming in. I had a lot of people asking, like, oh my gosh, what do we do? And I have to admit, at first I'm like, okay, let's put the brakes on this. Let's not be prescribing this stuff sort of willy-nilly without thinking this is a concern. Let's look at the study. I looked at it, but didn't have quite the discerning eye that I do now, that it's really been picked apart. But I would say that I thought, this doesn't make sense what I'm seeing clinically, because I'm not seeing these outcomes. I would always sit down and talk to my patients, look at their risks. If there's a family history of breast cancer, uterine cancer, their whole risk panel. And then I would see these women that had breast cancer that were using it, even knowing that it could be a potential risk and not having things reactivate. I'm like, this doesn't make sense. What they're saying is supposed to be happening. I'm not seeing it. My partners weren't seeing it. And I didn't really kind of dissect the study and go, oh, it's not what we're seeing clinically, ergo it's wrong. But I did sort of take a break, look at it, and would discuss it with my patients. And they would say, well, they're saying this is a problem. And I say, well, what do you think? I mean, everything in medicine is a risk and benefit. So if this is going to be dangerous, what's your quality of life? What is your risk factor for cancer? Are you concerned? Something to keep in mind. But if the benefit of this therapy is outweighing the risks, then your quality of life is better. Then what's the most important thing to you? As long as you know the risks of this medication, the benefits, where you're at with your life. And that's how I approach everything, is what are the risks, whether it's chemotherapy, what are the benefits? And yeah, sometimes absolutely the risks are going to outweigh the benefits. But I was, with the whole respect to that study, it was just not matching up with what we were seeing clinically. And like I said, I didn't sit down with a fine tooth comb, and nobody else did, because we were busy and maybe lazy. And it was just one of those things where it was like, well, that's what they're saying. I'm not seeing it. And I used it as a caution, but it did not completely change what I was doing. I would say it was one of those red flag moments, but still approached everything the same way.
Okay, and then flash forward to when you're in perimenopause and menopause because things have changed. So tell me what happened.
Oh my gosh, I think it's so funny because as a female going, from the time I in my 20s on, I had like the easiest periods. I didn't get PMS. I had a little bit of cramping that maybe one ibuprofen would take away. Was an active athlete. I just breezed through and it was very lucky. I did hit one section of my life where I did have to have an endometrial ablation actually because I had a polyp and it was having some heavy bleeding. And that was very nice because when they did that, it literally rendered me like amenorrheic for 10 years. My periods were almost non-existent to really light, but I still was kind of cycling. So, and then things, they did restart and came back before I went through menopause, but I got to 52 and I would, actually, let me back up. I was having a lot of horrible perimenopausal symptoms that I didn't really recognize and blew off to other health conditions. The first thing, though, I would say is my libido really changed in my 40s. It tanked. And my husband kind of joked and said, oh my gosh, you have the libido of like a nun or a stone. Go get this checked out. And behold, my testosterone was zero, literally zero on the testing. I'm like, is this even possible? And my gynecologist at the time was not very adept in natural HRT replacement and especially testosterone, but I did start on a testosterone supplement capsule, sublingual capsule at the time, which was really helpful. And that was my first kind of broach into HRT, let's just say. I had been on actually birth control in my 20s, but I had to quit it after my kids were born because I had such horrific migraines from it. I knew that was, we knew that could be a side effect of oral contraceptives was women who had a history of migraines. And now that I know more about epigenetics and why, I can look back and understand why, but I'll get to that later in our conversation. But so I got off of oral contraceptives by the time I was 30. And so by the time I was in my mid 40s and having, a little change and having early perimenopausal symptoms, the big thing for me was a tank in my libido. And then I started to have a flare up in migraines, but I'd had migraines from the time I was 11 years old throughout my life, various things. And I didn't put two and two together. I would wake up some of these mornings, like every morning at 3 o'clock, and wham, on the back of my head, this like horrific headache would wake me up, felt like I got hit with a bat. And I thought, this is odd. I'm starting to have these migraines. It's stress, all this stuff at work. I'm in a migraine cycle again. And I went to my neurologist, and of course, then they never thought to look at hormones and an impact on migraines flaring. Mine wasn't cyclic, so it was like almost an every night type of thing. So I started down the migraine treatment realm from Botox injections to some of the injectables, not even thinking, it's tied to hormones. Okay, so fast forward to I'm suddenly 52 years old. I haven't had my period in 6 months, 12, we get to 12 months and I'm like, oh, I guess that's it. And then boom, literally it had been more than 12 months since I had a period. And all of a sudden I started having horrific hot flashes. I had a little bit of night sweats, in my 40s off and on, but I just kind of blew it off. It was so bad at work. And I call myself one of the worst cases. I was soaking through clothes like every 30 minutes. It would come from my head to my toes. My clothes would be soaked. I'm seeing patients and I'm like, I got the armpit ring down to my waist and changing shirts and, all day, all night. And I was kind of at first laughing. I'm thinking, this is karma. I don't believe in karma, but I guess it's God's way of getting back at me because I was so insensitive to my patients. And I thought, okay, I'm a natural person. I believe in minimal pharmaceuticals. I'm up sensitive to a lot of things. I didn't do well on oral contraceptives. And my mother and my grandmother, they toughed it out through menopause and seemed to be okay. I'm going to do that too. And I tried all the things that I recommended to my patients, from the black cohosh and evening primrose oil and vitamin E and all, you name it. I tried all the things. Nothing was helping. So finally, I remember going into my colleague, my doc, PCP, and I'm like, all right, I can't take it anymore. Just give me lowest dose, lowest effective dose. And so I started on the patch, the estrogen patch, very low dose, 0.325. And I have to take progesterone, 100 milligrams, because I have a uterus. And I was still doing the testosterone, by the way, sublingually, and it was working great. And so that's where I started. And within, I remember probably 6 weeks, 8 weeks, I was like, wow, this stuff is magical. I felt great. And that was, I'm trying to remember exactly what year that was. And everything was okay. The hot flashes stopped. I was sleeping. The headaches were better. And because I was on a regimen, but fast forward out later when we moved to Florida years later and I quit taking my migraine injections and my hormones were stable. So were my migraines much more stable. So things were great and stable for a year and a half. And then we were into COVID and all of a sudden things started to go haywire again. And that's when my life changed and went upside down.
But okay, so what started happening?
So, gosh, okay. So the first thing that started happening was during COVID and all the podcast recordings that we were doing, we really started taking interest because more women were asking about women's health and HRT, and there was a lot more stuff coming out. And I thought, this sublingual testosterone, I don't know if it's the best thing. We did a few interviews with a couple different doctors and nurse practitioners talking about HRT and things available. And I'm like, I think I could maybe start trying some testosterone cream and maybe dosing myself better. And instead of going to someone, I just figured out how to do it myself, read a few books, and I thought, let's give it a go. So I started doing that, and I kind of overdosed myself on topical testosterone cream by accident. I was doing my levels, and I think I got to like a teenage boy level. I was like up to 500-600 and started having all the side effects. It was horrible. So that happened. And then I was blaming everything on that because of my high levels. And then I started to have like skin breakouts, and I'm like, okay, it's this testosterone. And I really dialed it back. Well, then within like a month, I started to feel anxious. I started to have panic attacks. I was retaining fluid. I felt swollen in my chest. My feet were puffy and swollen. And I had this massive breakout of rosacea on my face, like horrific. And I started having these consistent night sweats. And they wake me up 3, 4, 5 a.m. every night. It was like a dry hot kind of a thing. No, not a wet hot. And I'm like, oh my gosh, I feel like I'm going through perimenopause again. Something's wrong with my hormones. And so I reached out actually to one of the nurse practitioners that we had interviewed on our podcast because I really liked the model, the health. It was a telehealth practice that they had. I really liked what they were doing. They were testing things that I, had gotten behind on, I hadn't kept up with. And I'm like, oh, this is great. I mean, you can do Dutch testing, serum levels. They're using creams and injectables, sublingual. There's so many forms now available with hormones, not just patches. So I said, I need some help because I'm starting to feel crazy. But all the things that women talk about, like.
But you're on hormone therapy, right? Like you're on bioidentical estrogen patch and you're on progesterone.
Correct. And I was on that, but I'm like, either my levels are too low or.
And you've dealt with the testosterone problem. You're no longer like too high in testosterone. Okay.
Correct.
Is this a reverb from that testosterone experience?
Well, that's what I thought. But what was happening, and I can see it all now looking back 3 years later. But what I should say is this was August of 2023. We had gone through a lot. We had gone through various job changes, a few bad job changes, leave it at that. But it was worse than a divorce. Both my husband and I left the company we'd been with for many years. And it was really like a double divorce. It was really horrible thing. Then I had a hip replacement surgery in January 23. I had torn ligaments in my elbow and was getting an elbow surgery. We were selling our house and developing the property, and had my dad was unwell and I moved him back to Canada. We were then moved out of our house into dad's. We were looking at moving again. So there was so many stressors going on. And then there was COVID, and I had had COVID a couple of times. over the years. My body, I've had just the hip replacement that I thought I'd come through well, but all this stress, work stress, home stress, physical stress, mental stress, I was just chalking it all up to that. Plus, something's a little off with my hormones, and nothing stays the same. Things need tweaking, and that's why I started working with my new nurse practitioner, and I'm like, okay, I'm assuming it's all the stress and my hormones. Let's start doing stuff. So we started. She's like, oh yeah, you're probably, hot flashes, night sweats. You need some more estrogen. Let's up your dose. That's the first thing we did. So we up my patch. Meanwhile, we pack our, U-Haul and uproot our life and travel across the country from Oregon to Florida. And we get to Florida, and I'm supposed to be like living the dream life in the tropics in a new life. And I'm feeling worse. My hair is falling out. I'm not sleeping at night. My heart rate's going up. I feel like I'm going crazy. I'm mentally coming unglued, and I'm not. The sleeping disturbances are getting worse, and I know something's wrong. And we get here in October, and I literally spent, I'm gonna say, the next year and a half to 2 years like a recluse in my backyard by my pool, sitting in the sun, deep breathing, and praying and thinking, what is going on? Something's amiss with my body. And we kept tweaking the hormones all along the way and trying different levels and this and that. And then I'm going online and I'm following all these new influencers and doctors. And in the back of my head, I'm thinking, I didn't do well with oral contraceptives years ago. My mom didn't. And I remember seeing my naturopath and him saying something about MTHFR years ago, but I kind of blew it off. And so I start digging through my files, my medical files, and look at that. And I'm like, oh, MTHFR. So I have that. Maybe I need B vitamins. And I added those in. Big mistake, because I added in some methylated ones, which was wrong for me, which we'll get to later. But I thought, I'm a tough case. I can't get my hormones right. Like we should be able to figure this out. And then we're doing lab tests. I'm getting these experts involved. I'm getting advice from another gynecologist locally. I start increasing my progesterone, all this kind of stuff, and trying different methods. And I was getting worse. And I started to become suicidal because I was waking up every 2 hours at night, panicking. My heart rate was getting higher. My resting heart rate got to about 100. And it got to the point where if I walked around the house, my heart rate would jump to 120. Sleeping at night, it would be around 100. It would jolt me awake. I'm sweating. I'm panicking. If I ripped the hormone patch off, then I would feel better for a few hours. When I put on a new one, it would be okay for a little bit. And then after like day 2 or 3, it would be like escalating. So I thought, what the heck is going on? And yeah, with sleep deprivation, with having these nighttime panic attacks, I'm like, what is going on? So I sitting there with all this time in my hand, and I'm like sleep deprived. So I would almost have this panic until about 1 o'clock in the afternoon. And then things would start to calm down and my cortisol would go down. And so finally I hired a different nurse practitioner, someone else that I do. And I'm like, I need your help, because she was a whiz with biochemistry. She knew about MTHFR. I said, something is going on. And I'm trying all these different kinds. I tried, compounded progesterone. I was doing the estrogen patch. Then I tried topical cream. I said, something's not going right with my system. Like, what is it? And I was spending time on Facebook, looking at Facebook groups and researching things and following women on bioidentical hormones. And all of a sudden, what comes to light is this thing called, histamine. And I'm like, histamine, I know histamine from medicine for like causing allergies, etc. And then, I kind of remember hearing the term mast cell activation, and it's a fairly new term. It's not something we ever really learned in our training back in 80s, 90s med school residency. But I'm thinking, this constellation of stuff sounds a lot like my life. And I started putting 2 and 2 together, thinking that's what's going on. I did a lot of time researching, and I'm just really condensing this. But I hooked up with someone named Dr. Tyler Pansner, who then we had on our podcast, who does epigenetic testing. He has a PhD in pharmacology, and he looks at how drugs, pharmaceuticals, as well as supplements, hormones, your vitamin C, D, etc., are all processed through your own genetic pathways. He did gene testing and looks to see what's right for you based on your genetics. And I worked with him. And that's when the light bulb moment hit, was really Tyler saying, you've got this pathway problem, but you have a histamine issue. And I think all this estrogen is a histamine problem. And I'm like, I don't know. That just sounds too crazy. But I listened. And then that was in March of last year, 23. And then things have changed so dramatically since then. I mean, then it was just a cascade of stuff that started happening. I'll take a break for a minute, but what happened since March of last year has been crazy. It's actually led me to the point now where I figured out, it's not just my epigenetics, but the COVID exposures that I had, as well as hormones and how my body metabolizes them is so different than a lot of other people's that my body wasn't playing nice with hormones, even though everyone's saying I should be on these things.
Yeah. Okay, yeah. I want to jump in. We'll go to the COVID stuff in a minute, but this is one of the things about this conversation is that it seems to be, it's just not nearly nuanced enough, because if you have some of these genetic variations, MTHFR or COMT, I have those too, many things are not going to be good for you that you're told are good for you. And I have been learning this lesson the hard way the entire time I was in perimenopause. So I'm glad to hear you say supplements as well, because people tell you to take turmeric. Turmeric makes me deathly ill. Didn't know. People tell you to take maca. Maca makes me deathly ill. I didn't know. Folate, methylated. You talked about the methylated vitamins. My doctor, when she found out I had this variation, put me on those vitamins. I became deathly ill, and she couldn't even really hear me because that's her protocol. And I react to everything, including I tried to take progesterone. I was horribly depressed, horribly bloated. I started to look like I was 6 months pregnant. When I tried the Nuva ring, my whole body lit on fire. My doctor said that's not possible. I tried it when I was about 40 for birth control. The pill, I did not do well on the pill. And so I think this is part of this puzzle, this maze, this ball of yarn that we're trying to untangle, which is that it's not an automatic for a lot of us. And also, may I notice that you have in your childhood, you've overcome abuse in your you had sexual abuse in your past history. And so there's the genetic variation piece. And I've interviewed this really interesting woman, Paula Rastrick, on my podcast and spoken to her several times. She's in the UK. She almost didn't make it out of her perimenopause experience, being put on hormones, more hormones, more hormones, more hormones. Her belief is that part of this precision piece should be sensitive women. There are sensitive women with backgrounds like yours. Whatever the background is, it doesn't have to be horrific abuse. It's sort of how you perceived it as a child and how you processed it. So these are two incredible areas that need to be informed hormone therapy prescription. It needs to be questions. Let's check your genetic variation. Let's check what's your trauma history? What's your adverse childhood experience history? Because I have to think that this is part of the reason that some women aren't doing well. I don't know. This is all like, what does the trauma piece sound like to you? Have you aware?
Absolutely. What you're saying is so true. And I love that podcast that you did, and you talked about past trauma and how it affects things. I forget your guest's name, but really rung true with me. So here's what I'm so excited about now. I mean, I've always approached with my patients that, medicine isn't one size fits all. You had to treat the patient first. Everybody's so different. I never saw myself as a sensitive person growing up. And I learned.
Well, she calls it sensitive woman. She calls it sensitive woman.
However, I kind of laugh at myself now because I used to have those patients where they bring in like a list of medications and they'd say, I'm allergic to all these things. And there's 50 things on there. And we would roll our eyes as doctors and go, oh, it's one of those people, right? Well, I am one of those people. And it's not that you're truly allergic, but super sensitive because of your own genetics, multiple things, but I am that person. And now I understand why, after doing my epigenetic testing and then understanding my pathways, because I have MTHFR, I have slow COMT. I have actually, according to one doc I worked with, like a record number of double negative mutations, pathways that are blocked. Some people, they say, oh, there's an average of 8 to 12 kind of homozygous negative, and I have like 21 or more or something. It's like, oh my gosh. Looking back, so I was raised, there's so many pieces in the trauma piece, but I never really saw all this. I always thought I just got to be tougher. I'm hearing two things. I've raised to be a tough kid. I've got to be tougher. I was raised by a strong woman, mostly raised by my mom. My dad was gone so many years growing up. I had this abuse that I was was told the way it was dealt with was to just shove it under the rug and not deal with it because life goes on. It was kind of like that mentality. It happens to everybody. We just suck it up and keep going. And everything in my life as a teenager in my early 20s was pointing to that trauma and my genetics, but I didn't realize it until like I actually do the testing now that it's available at this point in my life. And so, yeah, I look back and that what had happened to me as a child from 4th through 6th grade really didn't get dealt with. I mean, back in the day, there was no, let's go to the counselor, and the parents didn't even really talk. My parents didn't want to talk about it. And so by the time I was in high school, I mean, that just, it raised its ugly head in a negative way. So I became anorexic and bulimic. My hormones are going crazy. And of course, my body does not do well with estrogen now that I know that. But that's happening. And I go off to college and I'm 17 and I'm stressed and I'm still on the birth control pill, which is a massive amount of estrogen and progesterone in a pill, negatively impacting my body, but not knowing it.
I always have to stop and point out progestin, not progesterone.
Progestin, you're right.
Yeah.
Yes, progestin. Yeah. And plus the past trauma and all this stuff, the control issues. My life just took a tank into the toilet. And I actually hit my lowest point, I say, at the porcelain bowl of my bathroom one night, with my bulimia. And I probably had been out partying and drinking. And I reached out. That's how I became a Christian. I reached out to God and I'm like, if you're real, then you got to show me you got to show me the way out of this. I need you. And funny enough, then a couple people walked into my life like right away that found me out, got me help. And I went through a rehab program, a patient, and dramatically better. But lo and behold, it wasn't like instant, but things got better in my 20s. But yet, that pill was still affecting me. And I still had panic attacks and anxiety and reacted to things that were histamine related without really knowing it, until the migraines got so bad that I quit. And then, so you're right. All of that trauma piece for me played a big part. Becoming a Christian and learning about true forgiveness, forgiving the teacher that abused me for 3 years was a huge part in that healing. What happens genetically, though, with medications and hormones, you can't, if you don't know better, you can't fix that. And we didn't really understand that until just recently.
Can I just say it's so weird because it's so insidious because you're taking it and you feel bad, but you don't think you never connect it to what you're taking.
Oh, so
it took me 15 years to figure this out.
So when I started on my HRT, I thought, okay, I was feeling great, on top of the world. I actually was doing this training program with Corey Lefkowitz. He's online, and I was like getting six pack and get muscles, and I was feeling great. And then things just went to pot, right? And so I wasn't thinking that it was the hormones or
you're connecting A to B. You're not drawing. Yeah.
In fact, if anything, what we were starting to hear was like, well, women need hormones. I mean, we got it all wrong. You need estrogen or you're going to be demented. You're going to break your hip. You're going to have a heart attack. If you don't take HRT, you're not doing right by your brain, bones, and heart. And it was this shaming thing. And then so in the back of my head, I was doing that to myself because it's like, shoot, I gotta try every single thing possible. I cannot give up. I cannot believe that I can't tolerate HRT because I'm so scared, because everyone in my profession, in mainstream pharma, Western medicine now, is back on board. And it reminded me of the breastfeeding shaming that used to happen. For a while, it was like, if you're not nursing your baby, how dare you? It was like shaming mothers for not breastfeeding their baby. And I think that's kind of like where we're at now with these two lanes in HRT. So all these influencers are coming out and they're speaking about the importance of this, and data shows, for sure we know. And it was all estrogen focused, which now we know is not true. I think testosterone is probably the best drug and most important. But in the back of my head, I'm like, I don't want to quit my HRT. I'm so scared. I'm just going to be one of these ladies that everybody not makes fun of, but it's like, how dare you? And yet when I did that testing and realized that not only did I have MTHFR, but slow COMT catecholamine O methyltransferase, I was getting a catecholamine reaction. I was jumping out of bed, and my resting heart rate is elevated because catecholamines are building up in my body. I'm not detoxing estrogen. I also have slow liver enzyme pathways that don't like to break down and don't do well with estrogen, period, and multiple pathways that don't play well with estrogen. It doesn't mean I can't have any, but a microdose for me would be equivalent to someone taking a high dose. And it took a lot of playing, and to the point where understanding even histamine reactions that estrogen liberate
You just to break this down really, like, I'm dumb, right? Because I think people just toss around histamine and MCAS and like, what is actually happening?
Yeah. So first of all, MCAS is mast cell activation syndrome. It's a big bucket term for, I mean, there's a lot. Mast cells are everywhere in your body. We used to think primarily most of them are in the gut, but they are in from your brain through your neurologic system, your gut, your lungs, your cardiovascular system. And mast cells release more than just histamine. There's multiple things in there, but most commonly there's histamine, which is the allergic type mediators, which I'll explain a bit more. There's immune mediators that cause inflammation cascade, and cytokines, which are also involved in immune system processes. So those are the three main sort of things inside of a mast cell. I like to tell people to think of it like when a dandelion dries up, and once the mast cells release, it's kind of like a dandelion just poof, releasing all that stuff into the air. So it shoots that out into the bloodstream. The histamine section of it, people think, oh, histamine, allergies like runny nose, sneezing, rashes, asthma, and wheezing. Yes, those are histamine liberated type reactions. But now we know that it's not just the typical asthma, eczema reactions. Histamine, there's 4 histamine receptors. H1 receptors, the common ones for skin reactions, allergic type stuff. H2 receptors, we've known about them for a long time. They're in the gut. They're the ones that liberate acid, increased stomach acid production. And I'm going to get it all wrong. I knew that I had it memorized at one point, but there's also H3 and H4 receptors, and those include histamine receptors in the cardiovascular system as well as in the neurologic system. Histamine, we've known for a long time, is an important thing that plays a role in our sleep-wake cycle. People know about melatonin putting you to sleep. Cortisol rises early in the morning and then starts to drop usually right after lunch, when you get that afternoon slump. But histamine is also the thing that wakes us up in the morning, and there's a balance between melatonin and histamine. So histamine gets released, and often we say sort of dumped right around 5 a.m. That's another very important piece. Histamine plays a role in regulating heart rate. It can elevate your heart rate as well. And so when things go awry and your body releases too much of it, or it can't process it and it's building up because of metabolism breakdown issues, which is another thing that I found that I have, but some people can't break it down fast enough. Some people produce too much. Then boom, you can have anything from not just asthma flares and throat tightening and true anaphylactic, but you can have anxiety attacks and middle of the night anxiety attacks that wake you up out of nowhere, waking all throughout the night instead of, when you're supposed to early in the morning. The gut, what happens in the gut, and happened to me, it's basically, I call it anaphylaxis of the gut. You get a big dump of, basically it becomes like a colonoscopy prep. You get colitis-like symptoms with diarrhea, and these trigger severe abdominal cramping in people and intestinal problems, rashes, all different kinds of rashes. But the psych piece, I think, and the cardiovascular piece, even probably some of the GI effects, are just underplayed. Yeah. But when you understand the histamine system, you see how it affects people on so many different levels. In perimenopause, our hormones start to go up crazy. They start to drop. Your estrogen and progesterone levels are going up and down. And estrogen liberates histamine. It actually tells the mast cells to release. So when your estrogen going up, your body wants to release more. Progesterone and testosterone protect that. However, any change in hormones, even progesterone, up and down, can confuse the mast cells. And so when things are going up and down, then histamine's getting released. And so this mast cell activation syndrome starts happening, and women are like, well, why can't I think? Why am I feel like I'm going crazy? Why am I waking up at night? Why am I panicking when I know I'm not there's nothing bad going on, but I'm having these weird panic attacks that feel
This,
physical.
sorry to interrupt again. This can be happening before you go on hormone therapy. This is like this is perimenopause in a way.
Yes. I mean, it's kind of like reverse puberty too, because in puberty, things can go awry, maybe not this severe, but it just depends on someone's epigenetic predisposition, but as well as perimenopause. Absolutely. So
Like it's the hormones. It's the hormones, but it's not just the hormones, right? It's like people say it's just the hormones causing this. And you're like, no, the hormones are.
It is a messenger that's triggering other systems in your. Exactly. So getting that balance is a key. However, do you know your own body? Do you know your own epigenetics? And this is the world that I'm so fascinated by now, is that, I actually got involved with a company years ago that was doing genetic drug testing to know how well you metabolize, say, a blood thinner or cardiovascular, but not really thinking about supplements and hormones and things like that. But now through, 23andMe to all these other companies coming out where you can do your genetic testing and find out how do you metabolize things and what pathways are broken or semi-broken or not functioning optimally. It's totally changed my thinking about hormones, diseases, and what was going on with me. But it's, I think, going to just like totally transform medicine, because now we know, gosh, a lot of what we're trying to treat with a prescription medication doesn't need that. Taking a supplement can fix so many problems. Throwing people on antidepressants for years when really it's an issue with how you metabolize, say, B vitamins or serotonin paths, etc. And so I think that's going to really revolutionize, and it's starting to revolutionize medicine. And the nutraceuticals swing, though, now I think it's just as bad as the pharma world. It can be just as crazy, and someone can be on stacks and stacks of pharmaceuticals, just like big pharma.
Nutraceuticals. You said pharmaceuticals.
Yeah, nutraceuticals. So it's just as nuts.
It is just as nuts. I used to be one of those people. I remember my dad, when I came home to visit, I remember him looking at me unpacking, and he just said, God, that can't be good for you.
No, there I am with that's kind of the swung. It's like now I have this giant bowl of supplements for all of this histamine and sulfites and COMT. And I'm like, what do you mean quercetin? I was taking vitamin C and quercetin through the whole pandemic because that was part of the protocol. And like, that's been messing things up for me too. No wonder I feel more crazy when I take quercetin. I mean, so learning all of this over the last year has opened my eyes, and finally like, oh my gosh, it's not just me not being tough enough. It's truly that my body can't handle this medication the same as the hormones, so as the same as someone else. So what are my options? Do I want to quit? Do I want to take less? Do I want, and I've tried everything. I've tried all of the routes now, from the creams to the patches. I did not do the oral estrogen pills, the injectables, supporting with, you name every supplement that also helps support it. And it's very individual. I mean, I could tell you what I'm doing now, but what
tell
really
us. Tell us what you're doing. Sorry, but tell us what really matters, and then tell us what you're doing.
Just that one, I hate this whole, you follow, I don't even want to say their name, whatever influencer on Instagram. It's like, well, there's a way. You just need to up your progesterone more, or it just needs balance. Or someone's going to tell you, oh, if you're having problems with histamine, you just need more progesterone. Well, there's people like you that cannot tolerate any progesterone. It's not the fact that you need more. It's like you can't tolerate estrogen or progesterone. You feel worse no matter what you do. And
there's always someone. Sorry, go ahead.
Oh, I was going to say, there's always someone that thinks they know the answer. They're well-meaning, and most of them want to help because what worked for them maybe will work for you, but it doesn't. And you got to take all this advice with a grain of salt, especially if you're like, there I am. I'm on Facebook groups learning from other women. I've always learned from patients who've gone through things and know more, and I'm listening. But what worked for one person doesn't work for everybody, especially when you take all this into account. Yeah, I think that absolutely. There's the other thing of, why would I want to put anything in my body? I don't want to take hormones. That's terrible. That's poison. Well, yes, our body's made estrogen, progesterone, and testosterone. And so any doctor that you go to and says, well, you can have estrogen, but you don't need progesterone because you don't have a uterus. Well, that makes no sense. Same with women shouldn't need testosterone. Well, that makes no sense because it's the most abundant hormone that our bodies make too. So there's two sides of it. And one is very individual. And as the individual, what are your thoughts? What do you want from your life, your health? What are your epigenetics? What's your risk factors? What did your mom, your sister go through? What do you believe? How active are you? What are you doing to support yourself naturally? Do you want all the things? Do you want the natural things? There's so many options, but you cannot pigeonhole people.
Sorry, you cut out
That's
there. Can you repeat that?
was going to say that what I really hate is this whole pigeonholing or picking a team. It's team pharma or team natural, and one is better than the other. No, they work together. They can work alone. I know many patients and family members that have reached their 90s without any bioidentical hormone replacement, had a great life, didn't have osteopenia, didn't go crazy, had no heart attack, and lived a long, vibrant life. And others that needed all of it. So I'm not on team anything. I'm on what's best for each individual.
Yeah, but also just, can we not talk about this? Like, you should be on this without recognizing that there's some women who can't really be on it. And that these tests should probably be done so you don't send women off into like a years long journey. Because I see this on social media all the time where people are saying, oh, it's been 4 years, but I'm still doing this, I'm still doing that. And I'm just like, oh my gosh, that's who has this amount of time? Like, you've lost time dealing with this. I lost, like, it was only 2 weeks with the progesterone, but it was a wretched 2 weeks. And I was so depressed and I didn't know what was going on. And I don't want to go through that again and try it again. And there's always someone there willing to tell me what I'm not doing right in my body to cause that to happen. And that if I just would, optimize this, then I could handle that. And it's like, yeah, but why don't I just not take it and try to see for me?
Correct. Absolutely. And that's what drives me crazy is there's always something. You're just not being optimized. That's another thing I hate.
Yeah. Which makes it seem like you're not healthy. Like someone in the fitness industry said that to me, like, yeah, well, usually you have to get when I told her about the progesterone, because she's a big progesterone person, because everyone's also like on teams, right? So you have team, the EMAXs, I call them, and you have the bioenergetic crew who are actually very vigilant about their like love of progesterone, and everyone should take progesterone almost as much as the EMAXs and maybe more. And so you have someone saying to me like, well, if you dialed in your food and exercise, it's like, it's dialed in, it's dialed in. Like, I'm not wearing a sports bra on television, on social media. I don't walk around in my bathing suit, but I'm in pretty good shape. I eat really well. Like, I don't know what else I could be doing. Sorry, that's a huge rant, but it drives, I get very irritated by people telling me why hormone therapy didn't work. And if I just did a few more things, then it would work. And it's like, I've gotten to a point where I don't need it to work. So I don't know. I'm not going to try it.
Yeah,
this makes me just pull my hair out.
I feel like punching some of those people in the face. It's so demeaning, and it's true because there are so many.
Not helping anyone.
They're doing all the things, and there's this one girl that I was actually chatting with and messaging and trying to help her, and I felt so devastated because she had a complete hysterectomy, had both of her ovaries removed, and she's in her mid-30s, and she is feeling horrible because she's been literally neutered, castrated, all her hormones gone, and she feels awful. And she's one of these people that is not tolerating them. She has severe histamine issues, and she feels horrific with progesterone, as you know, and her life is a disaster. And she has, 2 little children, and she can barely continue to live. And so it's horrible because there's people like, just do this. And you're right. There's team progesterone, and there's the team estrogen dominant. You just need to have like 1,200 to 2,000 milligrams of progesterone a day, or slap yourself in the bioidentical cream from, I won't say the name, but, and then there's
it's a mess, kind of.
All for trying and, trying as best as you can and reaching the end point. But women know their bodies very well. People know when something's wrong. And if you really listen to your body, it tells you what it likes and what it doesn't like. And if you're having, you're trying all the things and you're like, nope, this is just not for me. Yeah. Don't be afraid to like tune all those people out and do what you feel is best for you, because it's your one body, your one life, you're living in it. And don't anyone like scare you, shame you on either side of those things. I mean, we can all find someone that is thriving without the hormones with the full gamut and all the peptides and doing, XYZ, measuring their saliva, spit, whatever, 20 times a year because they're all into the numbers and they get their stuff tested and they're going exactly by their I mean, I'm over it,
Well, this is another reality tunnel. It is everywhere. You're a tracker, or you don't track. You are testing, or you're not testing. You are in hormone therapy, you're not in hormone therapy. You eat steak, or you're a vegan. You're like, it's never ends in every area.
So I think here, let's have the conversation briefly about what do women do? Because like you're kind of, I see you as the middle of the pendulum because you're covering both sides, just like I'm looking at both sides. And I feel for so many women, I wish I just want to reach out to all of them and say, like, because it's like, well, who do we trust and what do we do? Because there's a lot of people on this space now, as you know, that set up shop. They get some course in HRT and they're like an expert on every corner and they're horrible.
Makes me nervous. Makes me very, very nervous. Yeah.
Some people, just because, they're an MD, they're also horrible because they believe old school type stuff or they're not up to date and they're also teaching archaic type things or doing archaic things with patients. And people are like, who do I trust? How do I know what's real? What the info out there? And that's why I love to direct people to your podcast and what you're doing. But I think intuitively, like I go back to, it's like, what do you believe as a person and how do you live your life? And, do you want to be chasing numbers and data and on the cutting edge and experimenting and don't mind injecting and know the rest? Or are you happy to let nature take its course? Can you find a physician or a practitioner that is going to listen to you and respect what you sort of believe and what you want to do? I think that's the most important, really. I mean, because you can find someone that's team HRT and injections and stacking all the supplements, the DHE, pregnenolone, just all of it. Or you can find like the estrogen dominant camp. I mean, it's easy to find now. I think people have to be their own best advocate, get educated, and trust your gut and trust yourself on this. And it's the same for all things in health.
Yeah, you have to trust yourself, I believe, and this is maybe controversial. You have to trust yourself over your practitioner. Because one thing I have learned in 6 years of this, the gaps in knowledge, even some of the smartest people, there's just little gaps in their knowledge. And so if you fall into one of those gaps and you're not listening to yourself, then you're going to run into problems. Like you're going to run into problems if you keep doing what you're told and it's not working and you're not trusting yourself. And I believe that in menopause and perimenopause, we're being called to trust ourselves in this way. We've outsourced so much of I did anyway, so much of what I thought about myself and what I did to the rest of the world. And I just think it's just like you're bringing it back home. And one of the things that, do what you want to do. Like, recently I interviewed in the space of 2 hours, this naturopathic Australian woman who, she's not a naturopath, she's just a natural health proponent that makes everyone angry. And this chief marketing officer of Whoop, within 2 hours, she doesn't even get a thing checked, doesn't take a single supplement. This guy's measuring every single part of his body. And I left and I thought, they're both right. There's no choosing. My only concern is when you're passing through this transition to become who you're meant to be, I think. If you are outsourcing everything about how you feel to external metrics, then I'm just not sure you're ever going to be really free. That's my feeling.
Absolutely. I love it. That's so true. I mean, we can't ignore the fact that the big longevity space now that everyone's talking about, right? Overlaps into this in a huge way because you're hearing all this stuff about longevity and all these podcasts on, how to have longevity and maybe live longer, but live the best you can while you're alive. And then that transforms over into, okay, well, hormone replacement is a big part of that. So people feel this push where there's so many things from tests, you're right, to supplements, to things to do, from red light therapy. Like it's overwhelming. And I was reading, oh my gosh, do you know Jenna McCarthy? She writes a Substack that is super funny. My husband and I were reading this today. Sure, send it. I'll send it to you.
Sure.
It's hilarious. Basically, she's like making fun of the fact that when does it end? I mean, we've got our bag full of nutraceuticals now. We need, vitamin C and vitamin D and magnesium. And then we got our fish oil. And then I should be doing the red light sauna therapy and I should be grounding, but yet I should be meditating and then praying. But I got to make sure I'm getting my protein and my now creatine. And then, oh, by the way, collagen, supplement, but I need to get my exercise vest on and now I should be lifting heavy and not doing as much aerobics. And I should, grounding and taking out all the plastics. And it's just like on and on and on.
On and on and on and on. No matter what you do, someone will come in and say, no, you're doing this, but you really, do you know what's wrong with that? You should be doing this. And I'll tell you, for everything, I mean, you know this about science, but for a real trick of consumer oriented businesses that are selling supplements or drugs is to conduct their own research and then say, we have all this research over here. And then no one questions it because they're like, oh, it's the most studied thing. I mean, this is kind of what's going on with creatine, because I was like, creatine's great. I was taking creatine, and then I saw a woman on social media. I have an algorithm that's like open, like I come across these people. And so the problem is many people have not for over a decade. So it's shocking to hear. But, I'll come across someone who's like, guys, I see kidney damage. Then someone's over here mocking someone who says you might damage your kidneys from creatine. But this woman's pointing out the research. Well, don't I go look at it? And isn't she's really onto something. But then you're questioning creatine, which everyone believes in wholeheartedly. And for almost everything, when you look into it a little bit more, almost everything that involves you buying something, I feel like there's this flip side. And so it's very hard to know what to do. So I'm kind of on the side of like, I'm going to do as little as possible. I'm as little as possible. I'm going to do as little as possible. And I'm just going to, I know circadian rhythm and sunlight. I know grounding. I feel amazing. I feel amazing when I do those things. I know I feel great when I walk. I feel good when I work out and lift weights. I don't know what else to tell you. Everything else is an argument.
It's tough because then we've, I have people on our show and interviewing people I respect, and they're like, they have that mindset. And then someone else is like, no, I mean, think about it. Our food has been so depleted at the soil of micronutrients. And, we're friends with Dr. Sabine Hazen, got microbiome expert, and tests the soil, and it's just terrible. And someone else comes on and like, yeah, you got to take all the selenium, the iodine, and the stacks. And I'm like, really?
It's really hard what you do, right? Like, it's really hard. You get pulled in all directions.
It's just as bad. In fact, if not, it's like one person, oh, I respect that, I believe it. And then it's like, I am more of like, I'm kind of a minimalist. And some days I'm like, I want to throw my cell phone away.
Throw it all away. I just want to go make bagels. When I was a reporter in Ottawa and I was super stressed out, there was a bagel shop, before everyone told you couldn't eat carbs, which now you're supposed to eat carbs, right? So I would get this awesome bagel, and there would just be a guy making the bagels, and I'd be so stressed out, and I think I just want to do that right now. So I always think the bagel maker. Yeah, it's absolutely bonkers what's going on. I wanted to tell you though that about 5 years ago, I interviewed this influencer from India, and I cannot remember his name, but he made me so hopeful. I've never forgot what he said. He said, Anne-Marie, think of what our bodies have adapted to. We have adapted slowly over time. This is the power of the human and biology. And so when people say those things, you think, my God, this is terrible. The soil is terrible. I do believe what he said, though. We've been slowly adapting. Our bodies are unbelievable machines, and they always want to be in balance. So I don't know. What do you think about that?
Well, totally the truth. Absolutely. Yeah. Although our bodies do adapt. However, when you look at things like, I really believe, in our heritage and where we come from, and almost like eating like your ancestry, because that's how your DNA is wired. And you look at what we've done to Canadian and Native American Indians who are used to grazing, and now they're eating fast food, or even Africans who just have the highest rate of blood pressure, and they get on, I'm not saying they're all eating McDonald's, but the whole US is eating junk food and fast carbs, and what it does to them when their bodies and ancestry is used to a certain type of food source, it's even more devastating. And so our bodies do adapt, yet you can't deny you're like back to the epigenetics and DNA, what works best. And so I think it's a bit of both, but you're right. I think we exaggerate and freak out a little too much. That yes, our bodies do compensate for a lot of things, and it's all the pathways biochemically, like whether you have, like, it goes back to whether your MTHFR slow comp, some pathways not working right. Like Dr. Ben Lynch says, you're not completely crippled. The body learns to adapt, and there's other paths and things that kind of take over, and it's that way. And so you're right. I mean, I think just drowning yourself in supplements like Dave Asprey is just as unhealthy.
Pretty good though. I interviewed him 10 years ago. The guy looks phenomenal. I know he had a facelift, but I mean, before the facelift, I was like, why are you getting a facelift? You look amazing. Every time I look at you, you're going to look like a toddler next time I see you. I mean, anyone who's arguing with, I don't know what he's doing. I do know kind of what he's doing, but yeah, he does look pretty good. So what are you doing then? Because we didn't close that loop.
So, well, a lot has happened. Fast forward to throughout this past year, and I was talking before we started recording that I realized that the COVID impacted me a lot more than I realized. And through just working with our friend, Dr. Peter McCullough, getting tested, finding out the root of my MCAS flare up and exacerbation, because I've had problems with histamine and sulfite metabolism and mast cells throughout my life, although never this severe until, post-menopause, was because of my COVID exposure, being exposed in working around COVID continuously throughout the pandemic, and that it's probably the spike protein is in my body replicating in a lot higher level than it needs to. So I'm addressing that. Along the way, though, I got myself a great education in HRT, all the modalities and all the things, and I didn't want to completely throw the baby out with the bathwater and just dump it all. I almost did at one point, and I really weaned myself down off. Estrogen is not I need it. I think we all need it. However, I respect women that don't do HRT. And I think everybody's bodies are so different that I think maybe naturally through their own cells and adrenals, I mean, you still produce some. So some women are better at producing that post-menopause than others. Myself, I've discovered the joy of injectable hormones and being able to control my dose. And I literally am on such a low dose of estrogen, it's like sniffing it, I say.
It's too bad you couldn't have one of those like Vicks, remember?
Yeah, pretty much. That's pretty much, I just touch the vial. And so I'm on a teeny tiny little dose of estrogen. You gave my lab values to some of these fanatics that say, oh, you're not getting bone, brain, and heart protection. I'm like, I don't think my levels ever were that high throughout my whole life. I don't tolerate it. I'm getting some, I can tell because my vaginal health is great.
Okay, good.
I could tell based on what's happening there, as well as testosterone I use. And I like to keep my levels at the high normal range, and it's my superpower. I like testosterone.
Okay.
For me, it works. And progesterone, I can take a little bit. I do the lowest dose, and I do the oral 100 milligram capsule at bedtime. More is not good. I do respect and have used the cream, topical cream as well. And I think that's a great product too. For me, I figured out my balance, but that's what I'm doing. And if I were to have to pick one, I probably would just pick testosterone if I could only have one.
You don't have to though. No one's making you. You can. No, this is the great thing. We do have options. We do. I know this is another theme on social media is that we don't have options and men got all the I get it. But we do have a lot of options. The list of what's available is quite long.
I do use a vaginal estrogen as well, twice a week. I use the Untitled and a little bit of topical cream as well. I've reached my nirvana here, but it's been a 3-year journey. I was blaming so many other things on going crazy. And it's tough here I am, a doctor who was trained in hormone replacement, saw patients.
And you rolled your eyes at them? You rolled your eyes at them?
And I couldn't even figure out what was going on with me and even with help. And so it's very...
No, you rolled out your eyes at menopausal women when you used to treat them when you were young, right?
I'm like, oh, poor thing.
I think this theory, though, when you're young, you're so scared of being old that you don't really like older women. Like, I feel like I was like, oh, you're 50. Like, oh, I don't know.
There's that thing of like, oh my gosh. And now I'm like, oh my gosh, I'm turning 60 this year. And
this is awesome. It doesn't matter. And I have some younger friends now, and we go to yoga and coffee together. And I just love it that they like hanging out with me because it seems like that feeling is gone, like that sort of like, oh God, I'm so scared of getting older. So that's progress too, right? But I love the end of this story because this story doesn't end with you saying, and hormones ruined my life. And, I went off them and, this is what it's all about. It's all these shades. It's brilliant that you found what you need.
And learning about, my body and histamine and, a lot of other things I've changed. My response to alcohol is horrible. So I've had to change that, much to my chagrin, because I do love my wine. But learning what works for my body and what doesn't, and taking the experts that are out there in all the fields and just listening to what they have to say, but saying, well, how does this apply to me and my health and my body? And is this going to work for me or not? And not being ashamed, not being shamed by what the trends are, and knowing that maybe having your estrogen level at 100 is like, yes, the best thing we could do for women. You know what? It's okay if I can't achieve that, because I can't, and I'm doing the best that I can. And I think I want all women to hear that.
Yeah.
The best that you can, and be happy about that and be okay with it, because we can't, perfection is just, I don't know, it's one of those social media things that doesn't exist.
It never has. It's never existed. It was, I remember my mom saying to me when I was a young girl, when you grow up and you're going to get married, she never knew that I wouldn't get married, but she said, you're going to see other couples and they're going to act so in love, and it's going to make you question your own relationship, and they're going to be all over each other, and you have to ask yourself, what are they trying to prove? And I just would love to see what my mom would have thought of social media. I think about it every time I see these things. So I just, no one's perfect. It's just a big game. Now, I really want to get into the COVID stuff with you, the spikeopathy, long COVID. I want to get into all of it, but I just don't think we have time. Like, I'm going to have you back and talk about it, because I too have experienced this problem in the last year. It was life altering, very, very scary. And I think probably a lot of people are experiencing this and don't know that they're experiencing it.
I would love to come back and talk about it, because what I'm seeing, that I'm still in the Facebook groups and some others as well, and seeing, especially say the MCAS group, for instance, or even the bioidentical hormone, women are like, I'm struggling so bad, I'm having all this happen. And I'm like, when did it happen? It seemed like it wasn't just menopause, it was, I got COVID and boom. And they don't realize the impact that COVID has had. And people know about the cardiovascular path, the long COVID, the clotting, the myocarditis, those things. But the autoimmune piece, and MCAS is the big one, is getting more attention now. But it's also just as prominent. And, Dr. Tina Pierce from Britain has brought that to light, speaks out and does a lot on it. A few other people in the US that I could mention, but I would love to have that discussion, because it really does overlap with hormones big time. And that's me. I blamed it all on hormones.
It's also not simple. It's also not simple because, and this isn't about like the vaccine or the not the vaccine. This is about, COVID actually is pretty harmful, or can be for some people. And the anti-vaxxers don't want to admit that. I had that, the people in my life who are anti-vaxxers are just like, don't want to believe that I could be harmed by COVID. That breaks down their whole argument. So it's a really tough situation. So yes, we're going to devote I'm going to have you back soon, and we're going to talk about that, because I think probably people are really suffering and they don't know it, and they're not going to get it from their doctor.
No. The doctors don't even know about it, or don't want to admit. I mean, we've worked in that situation when we were seeing things happening, and we're like, oh, couldn't possibly be.
Right. Look, when you're in a field and you have a belief system about that field, we talked a little bit about this before we started recording. This happened to me in journalism at the beginning of COVID, when I just couldn't believe the way things were being reported. It's very, very painful when you've been in a field for 25 years to say, oh my gosh, are things not what I thought they were, right? So it's a lot. So when we come back, I'd like to talk to you about that too, because I think it's a similar.
Love to. I just so fascinated with, the whole, not just menopause, but midlife life, and how things, just our thoughts on, from the hormones, the nutraceuticals. Now COVID is a big factor because it's affected the world, and it's going to keep affecting people as we go forward. And everyone that's been exposed to the virus, to the vaccine, the shedding, whatever you believe, we've all been affected, whether you took a vax or not, whether you had COVID or didn't.
I didn't like wearing a face mask, and I did roll my eyes. I never said anything or bothered, but now I see people wearing masks. I'm like, hey, I feel you, because I don't want to go through that again. I've gone through it twice in the last year. You have to be willing to revisit your prejudices. And
that's PTSD. We've had PTSD from that.
Yeah. Yeah.
And my husband, he's still working in urgent care, and COVID for the most part is, and now it's, it's a coronavirus. It's mostly a cold, but people are stuck in that whole mode of the pandemic where people were dying. And he's like, COVID's a bad cold, mostly, maybe sometimes, but what did you do in 2010 when you got a cold? Did you freak out? And,
No. But we are saying it can cause problems. Definitely watch for when May's back. I can't even thank you so much for going all through this. You're a delight. You're someone is just, I love how we all start talking and then it's like, oh wait, we have to talk and we're so busy, you know, you see an email and then you lose it.
Exactly.
I'm so glad we made this happen.
Yes, you meet so many great people and the conversations are so fun. Yeah, just happy to share my experience.
Yeah.
Professionally, personally, and help people, especially women, through this stupid time of life. And it's not so bad, but
it's not so bad.
I would love to come back on your show anytime.
Come back. BS Free MD. I love it.
I can hardly wait till you're on ours. That will be coming soon. A little teaser.
Great to talk to you. Glad you're feeling better.
Thank you so much.